How does a lack of disability supports lead to mental illness? When persons with disabilities and their families do not receive adequate, accessible, and timely supports and resources, there is usually a decline in mental health. Financial stress of paying for unaffordable disability and health-related supports and resources not covered by the Canadian government, such as counseling, therapies, assistive technology and devices, medical supplies, and some medications. For persons with developmental disabilities and their families, this constant pressure often fuels anxiety, depression, and chronic psychological distress, especially for those already living in disability poverty. Disability poverty leads to helplessness, despair, worsening mental health, and anxiety about food and housing security. Living with persistent uncertainty places persons and family members at significantly increased risk of developing severe anxiety, depression, and other mental illnesses. Persons with disabilities and their families are routinely forced to make impossible choices like food or medical supplies, rent or counseling, transportation or therapies. Significantly reduced access to mental health care due to social, physical, and financial barriers, leading to untreated mental health, which escalates mental health deterioration. Discrimination compounds these harms. People with disabilities often experience stigma, dismissal, and medical trauma. Alarmingly, many mental health professionals refuse to care by outright saying, "I do not specialize in disability," systematically excluding persons with disabilities from support. How will persons with developmental disabilities be affected when mental illness qualifies for medical assistance in dying in March 2027? Canada is moving towards allowing MAiD for individuals whose sole underlying condition is a mental illness in March 17, 2027. This expansion will be within systems that are already marked by ableism, discrimination, poverty, food insecurity, housing insecurity, and inadequate access to healthcare or care will push many persons with disabilities towards getting MAiD done. When disability and chronic illness supports are absent, it causes intolerable life circumstances because their basic human needs are not being met. In this context, it will drive many persons with disabilities to get a mental illness diagnosis for the sole purpose of granting themselves the ability to kill themselves through MAiD. When life is made unbearable through deprivation and exclusion, death may appear to be the only accessible relief. Even small changes in safeguards carry enormous consequences. If mental illness becomes eligible for MAiD, removing or weakening a single safeguard could make it possible for persons with disabilities to access MAiD if they have a mental health diagnosis, or for families or substitute makers to make that decision on their behalf. If MAiD is accepted for mental illness, it will not be a large leap to imagine its expansion to persons with developmental disabilities. Once psychological distress is evaluated without addressing ableism, social, economic, and social barriers in society faced by persons with disabilities and their families, blur the boundaries between mental illness, disability, social vulnerability, become dangerously thin, raising the question, who will be next on Canada's MAiD agenda chopping block to be discarded? How ableism pushes people into killing themselves with MAiD. The Canadian government policies and laws do not value the lives of persons with disabilities and or illnesses by making MAiD easy to access but difficult to access resources and basic human needs for persons with disabilities or illnesses to live. Canada law focuses on access to MAiD rather than providing adequate support, resources, and medical care to persons with disabilities and/or illnesses. Canada is the only country where people can receive MAiD as a first-line treatment without first trying other treatments. Canada provides medical assistance in dying instead of medical assistance in living. Healthcare encounters often reinforce these messages. When practitioners minimize pain, deny accommodations, dismiss mental health concerns, or view disability as a tragedy or hopeless, it leads to worse health and mental health outcomes. Inaccessible clinics and discriminatory attitudes also worsen health outcomes. Many persons with disabilities are being encouraged by health professionals, family members, or friends to pursue MAiD, even when they did not express interest. There are many documented cases across Canada showing that doctors and nurses who have encouraged persons with disabilities to get MAiD done did not receive disciplinary action when reported. MAiD legislation views disability with sympathy and pity and helps persons with disabilities to access assisted death as merciful. This is an ableist assumption that resonates with Canada's history of neglect and exclusion, which sees states of disability as inferior. MAiD is a rebranding of the Canadian eugenics movement. Canadian society views persons with disabilities as a killable class. What is the solution to all of this? A national disability insurance plan would create equity for persons with disabilities by replacing Canada's fragmented, underfunded, and discriminatory disability support systems with a universal, rights-based federal disability government program grounded in fairness, dignity, and full participation. The NDIP would ensure that all Canadians with disabilities, including those with developmental disabilities, would receive fair supports, income, healthcare, services, and opportunities to thrive and fully participate in society. The NDIP would massively decrease the need to access MAiD as a medical treatment. This will ensure that persons with disabilities would have actual assistance in living instead of only assistance in dying.